Next, we're gonna do our in the clinic exercise to help Jenna learn how to properly do deep neck flexion. So I'm going to put the blood pressure cuff underneath her head, and I'm gonna pump it up to 20. Okay, Jenna, you see how it's on 20? I want you to do deep neck flexion until you see it rise from 20 to 30. And we're gonna hold this for 10 seconds. Good, hold, 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 relax. We're gonna have her do this 10 more times for 10 seconds, and hopefully she will get a score out of 100. But we're just trying to make sure that she knows how to properly do it so that way she can do her home exercise program.
This is an example of a 1x4 exercise. What you're going to do is have a resistance band. You're going to put your arms out in front with your elbows extended. Pull your arms away, hold for 3 seconds, and slowly bring them back in. This will help strengthen not only your neck muscles, but also your trunk. Okay. To make the exercise more difficult, you can shorten the resistance band. And to make it easier, you can lengthen the resistance band.
For our next exercise, we're gonna have Jenna here in quadruped, and we're gonna do bird dogs. Bird dogs are gonna help strengthen her paraspinals, which in turn are gonna help strengthen her core, which will help with her neck pain from whiplash. Okay, Jenna, I want you to raise your right arm and your opposite leg, and I want to have you point. Good, hold, back down, good, and then go to the opposite. Hold, back down, good. I would have my patient continue to do this. We want them to do 10 for 3 sets, and we want her to do these 3 times a day.
So our next exercise in the clinic, we're gonna have you work on scap squeezes just to strengthen your scapular muscles and kind of improve your posture. So what I'm gonna have you do is I want you to stand with your feet like shoulder width apart, have your hands hanging down by your side, and I just want you to squeeze your shoulder blades together in the back. And you're gonna hold it there for 5 seconds, and then you can bring it back down to normal. Good. Very good. And we'll do that a total of 3 sets, and then 10 reps holding for 5 seconds each time. So another exercise we'll do in the clinic, we're going to do shoulder shrugs, and this exercise is really just going to work on strengthening her upper trap and her levator. So after that whiplash injury, just to get that strength back. So what I want you to do is you're holding 5-pound weights in your hands, and I want you to bring your shoulders in a straight line up towards your ears. And hold for 5 seconds, and then you can bring them back down. And we'll do that a total of 10 times, and then we'll do 3 sets in each treatment session.
And now we're gonna go to our home exercise program. Okay, Jenna, for when you're at home, we want you to stretch your chest muscles so that way you can have better posture. So I want you to put both of your hands on the door frame. I want you to step through the door until you feel a comfortable stretch in your chest. And I want you to hold this for 30 seconds, okay? Good, you feel a stretch?
Yep.
Awesome. We want you to do this 3 times a day, either after meals or commercial breaks or whenever, and we want you to feel a good, comfortable stretch.
So for our second home exercise program, what I'm going to have you do is you're going to do an exercise to strengthen the muscles in your neck to kind of help alleviate some pain. So what I want you to do is I want you to watch me. I'm going to have you put your fingers on your chin just to kind of guide your movement. And I want you to look, well, you're going to stay looking forward and you're going to move your chin straight back. So can you do that for me? Okay. Well, I want you to keep your head looking straight ahead and try not to look up at the ceiling. There you go. If you're looking in a mirror, you will see a double chin, which is good. That lets you know you're doing it right. So I want you to do this exercise 3 times a day and do 10 each time you do it. And just whenever you think about it during the day, just try to get it done.